Hey, I'm Olivia.
I'm Peyton.
I'm Dula.
And I'm Kivana.
And today we're going to talk about the healthcare access in the United States. So over the first half of the decade, a result of the Patient Protection and Affordable Care Act of 2010, also known as Obamacare, was phased in over 4 years. It was entailed that every citizen was required to have health care access by March 31st, 2014, or they would face an income tax surcharge. With this act, 20 million adults have gained healthcare insurance. Even the numbers of uninsured have significantly reduced. The penalty was eliminated by the Tax Cuts and Jobs Act effective in 2019. An estimated 27.5 million people, 8.5% of the population, went without health insurance in 2018. That was an increase of 1.9 million uninsured people in the United States. More people were covered by Medicare, but Medicaid coverage declined. The number of uninsured children also rose, and there were more uninsured adults between the ages of 35 and 64. Significant disparities in access to care was caused by sex, age, race, ethnicity, education, and family income. These disparities exist with all levels of access to care, including health and dental insurance. Having an ongoing source of care and access to primary care is very important. But disparities also exist by geography, as millions of Americans living in the rural area lack access to primary care services due to workforce shortages.
In comparison to other places around the world, the healthcare in the United States is not quite up to par. This includes barriers such as the high cost of care, inadequate or no insurance coverage, lack of availability of services, lack of culturally competent care, and in the case of coronavirus itself, testing has not been widely available whatsoever. Recently, it has just been becoming widely available around the US, still not available for everyone. And within the US, there are only 97 labs that are verified to be testing coronavirus tests. Whereas in South Korea, they were offering entirely free healthcare testing to the public, testing everyone. And they have been on a steady decline, successful in flattening their curve, so that the other day, they had no new domestic cases. And as of yesterday, only 2 were reported. And most of these cases haven't even been domestic South Koreans. They have been people coming in from elsewhere.
Compared to South Korea, the United States healthcare system has not been able to take all of the weight that this pandemic has put on it. Our healthcare system was not situated to handle, even withstand the amount of time that we've been under pressure, whether it be ventilators being sent across the country or nurses bargaining for medical supplies. During the circumstances of this pandemic, circumstances are just challenging, and that's whether it's for medical professionals or essential workers all around the United States. Specifically within the sociological perspective, most of the essential workers are immigrant workers and people of color who have to go from cities like my own in Chelsea, Massachusetts, to go to hospitals and work within the COVID environment and be more susceptible to the virus in itself as well as the environment they're in. And specifically, families of color are more susceptible to the disease, not just because of their social location, but because of what's been instilled in them and in the culture of the fact that going to the hospital is a fearful experience, especially during these times when there's so much panic and fake news out that is stopping people from really taking the help they need. And within an experience like going to the hospital to get tested for a disease like COVID that has this light on it as it does now, makes people scared, makes people feel alienated, and really highlights the atrocities that are already at hand. COVID has highlighted a lot of the disparities that are already present within the healthcare system, but now with COVID in line and what's going on during the pandemic right now, it just shows that our healthcare system needs proper reforms and really needs to be able to be a more equitable system for everyone in the United States.
Like Dula was saying, Chelsea, Mass is also my hometown, and it is an example of a sanctuary city. It is the predominant sanctuary city in Massachusetts as the state. A sanctuary city is basically a city that allows undocumented and immigrated people that come here and don't have to worry about getting like deported or any other um, inequalities that exist living in a normal city. So being in a sanctuary city, the cases seem to rise significantly. Similar to my experience, the city is predominant Latino based, and they are of people who are farm workers or essential workers, and they are afraid to go to get tested because of their status. I explain more of this in my personal statement video.
So now you may be wondering, why does all of this matter? So everyone, we're all humans and we deserve our basic needs and rights met without having to unnecessarily suffer or fight harder just to exist. So in fighting for a better future, we have to be aware that there are inequalities and inequities that are present and highlight the need for reform like in the healthcare system, because that is essential. And not having access for people creates a lot of barriers in the lives of people, and it impacts them in more ways we know. So some ways that people may be impacted is physically, socially, mental health can be impacted, economically, and overall quality of life. So thinking about all of the things that everyone has said about the virus, we have to be aware that when the virus leaves us, we need to remember some of the things that we've been doing in this time that are the most helpful, and also remembering the things that have not been helpful that need to be changed. So like some things that may be helpful for people now are free testing, paid sick leaves, homes for people that are without homes. All of these things can improve quality of life. And to better, other things to better the healthcare system is providing transparency about different services that are out there, cheaper healthcare and options for people without a job or with a job, whether they leave that job or there are other circumstances. Healthcare shouldn't be rooted in employer and employee relationships. And there should be an overall comprehension for healthcare to better the access for it.
Thanks for watching.